Ready to get started. Please sit up conveniently. Good morning, my dear colleagues. Once again, my name is Marichka Paselska. I am press secretary of the Public Health Center. To act up as moderator this morning on the 24th of October is the global polio so is the Global Day to Fight Polio. So we're here really to give you a good reminder about this hazardous disease and really to brief the society about the importance to vaccinate against polio and speak about the status quo here in Ukraine, about the outbreaks and about outbreak response as well. So we have the courtesy of Igor Kuzin, who is Deputy Minister and who is Chief Sanitary Physician of Ukraine here with us, Guillaume Simonyan, who is in charge of WHO emergency program in the healthcare sector, and Murad Shahin, who is the UNICEF representative director here in Ukraine, and Umit Sharapov, who is the senior advisor of immunization program at the US CDC. So we are operating in such a mode. So first of all, we'll give the floor to each speaker first, and then we'll enable the journalists to come up with their questions. So for convenience, so every one of you have had their own headsets. So for simultaneous translation, and hopefully we'll have very fruitful and prolific day this morning. So the first one is really Mr. Igor Kuzin, really to talk us about the vaccination status quo here in Ukraine and touch base on the event that we are all concerned with now and really concentrate on the details here. So the floor is all yours, Igor. Yes, my dear colleagues. So first of all, I just would like really to say that last week, we had really the Global Polio Day, and the global community on this day, once again, I would like really to make it a good point that polio is very hazardous and very menacing, that is absolutely vaccine preventable in immunoprophylaxis, and only provided that we have really good polio coverage vaccination, so no reported polio cases in the countries, and the children will be able to feel themselves secure. That is why it is of an utmost importance really to discuss polio, poliovirus as well, and then actually protection against poliovirus development, bearing in mind that polio unfortunately is back to Ukraine, and it has become really the cause of paralysis of a child, really of 18 months old child in the Rivne region, and so we do have this epidemiological investigation ongoing, and the preliminary findings of the investigation will be presented by the Public Health Center, because our team of the Public Health Center has been very proactively involved in the epidemiological investigation on the scene in the Transcarpathian and Rivne region. So with the support of the UNICEF colleagues and also as well as our colleagues from the WHO, and the preliminary findings that we'll be able really to present in public, will be shortly announced. So polio really can cause lifetime paralysis, and sometimes might really end up in a lethal case. And actually taking advantage of the situation, I just would like really to call out to the parents really, so don't be negligible about your children's health. So once again, review your child's vaccination status, and please make sure that your children have been exposed really to a full cycle of immunizations within the framework of the national immunization calendar here in Ukraine. And according to the national immunization calendar, so the scheduled polio vaccination is injected really as at the age of 2, 4, 6, 18 months, and also at the age of 6 years and 14 years of age. And this is the frequency that must be really adhered to. So in your children's medical file, so if you see that you have skipped over your immunization episode, please come and see your general practitioner or pediatrician, so as really to get advice how really to catch up, or how really to adjust those vaccines so that you really forwent in this administration. So, and immunization now is available in the state-run polyclinic facilities, and despite the fact that both the government and the nation really putting a lot of emphasis on COVID-19 vaccination, so the routine vaccination must not be stopping in any case, and the vaccination adherence to the national immunization calendar is of an utmost importance. It is paramount, and that is why the infrastructure has been set in such a way as really to keep the scheduled vaccination ongoing smoothly and swimmingly. Please feel free really to refer to the state-run polyclinic settings to ensure your pediatric vaccination in accordance with the immunization calendar. Unfortunately, as of the 1st October, only 59.7% of our children, so in the first year of age, so who demand mandatory vaccination, have gotten all the 3 polio doses, and this is really critically low coverage for Ukraine. That is really presenting a certain epidemic hazard of polio prevalence and proliferation nationwide, and a lot of countries really now coming to grips with the routine vaccination just because a lot of healthcare workers right now engaged in COVID-19 emergency response. But the infrastructure here in Ukraine really is kept in place, and those healthcare so workers really who do routine vaccinations really carry on with their responsibilities. That is why Ukraine has all what it needs to vaccinate within the routine immunization. And our shared objective, and also in the scan of the global polio outbreak, so as really to make sure that none of the children must have polio or shall have poliovirus. I would like really to address all our medical records really to make sure that the vaccination really proceeds as it must do in accordance with the schedule, and also would like really to make sure that we have really good supervision in place assured so for the immunization calendar adherence. So far as the situation that has broken out in the Rivne region here, I just would like to really anticipating the agenda, still slightly saying that in Ukraine. So we have reported so a of this DPV2 poliovirus type, confirmed vaccine-derived poliovirus type, and it is confirmed by the WHO-based reference lab and the extraordinary committee. So in the Rivne region has been called really that really declared emergency epidemiological situation within the Rivne region limits, and now based on the governmental guidance, so we have launched a 0 round of pediatric immunization in the Rivne region, so that is so much required really to safeguard our children against poliovirus. In our next critical steps, so to retaliate this outbreak is all about really high quality and full-time epidemiological investigation, and now it takes 2 teams both in the Rivne region and in this Transcarpathian region to retaliate, and those teams really operate pursuant to the guidance, to the errand of the Chief Sanitary Physician of Ukraine, and also the visits already have been well scheduled and planned and performed, and now we are hearing from the laboratory with the laboratory test results for those visits, and the emphasis for those regions really to reinforce routine immunization. So for the under 1 year old inactivated polio vaccine IPV, likewise polio coverage of the other age cohorts, and we do have separate meetings with the parents ongoing, so who say no to prophylactic immunizations, and we are trying really to talk them into immunization or either provide to them upfront evidence-based what is poliovirus, its disease process and the entailed risk, and also we do contact tracing and testing really who share the same family setting or who have communicated. So it's really to make sure that we are back on track on the epidemiological investigation for good findings. And especially in the Rivne region, will have really zero round of pediatric immunization, and after we will have performed full-time epidemiological investigation, we will be able really to concentrate on the rounds, multiple rounds of the other pediatric immunization scheme that we will announce later. And I would like really to stop here and to really hand the floor to our other colleagues, and in the course of this discussion we'll be able to take more detailed questions. Thank you very much, Mr. Igor. Thank you very much. And now I would like really to invite the WHO representative to come and share your own deliberations and concern about the situation here in Ukraine with polio, and perhaps really talk us through about the international experience really. Guillaume Simonian, the floor is yours.
Thank you, dear colleagues. So I'm very glad to join you today. On Sunday, we had the World Polio Day. And it's important here to look back at history a little bit. In 1988, the World Health Assembly, so all member states of the World Health Organization, committed to eradicate polio. To date, we've had a huge global success, and it's important to celebrate those successes, looking into the celebration days that we had on Sunday. At the time, in 1988, we had 120 member states in the world which had wild poliovirus. Poliovirus is a dangerous pathogen on which we have the solutions. The solutions are, as Ihor highlighted, vaccination and prevention. This effort in 1988, and this decision by all member states in the world to eradicate polio, to date has managed to eradicate 99.9% of the circulating polioviruses that we had at the time. And children today are more safe than they were at the time, in Ukraine and elsewhere in the world. But it's important also, and many partners, we are part of those partners, UNICEF is part of those partners, have got together to support all member states, and we are here to support Ukraine before you today, and we will stay to support Ukraine in this disease response and in general. 5 out of 6 WHO regions around the world are declared today free of wild polio, including the WHO Europe region, which was declared polio-free in 2002. But it's also important here, and Ihor highlighted that in his speech, that polio will find all possible ways to come back. What to do not to let polio come back is routine immunization, vaccinate your children. And here we all have a collective responsibility to pass the right message. The right message is get your children vaccinated. And Ihor highlighted it very well in his speech, and I would like just to reinforce this point. And you, as the media community, should pass the right message. This right message, once again, is vaccinate your children. That works. We have only 2 remaining countries in the world, Afghanistan and Pakistan, which have wild virus circulation. And 2 out of the 3 types of wild polioviruses have been eradicated. Once again, big success at the global scale. However, every child, as I mentioned, remains at risk if this vaccination coverage goes down. In Ukraine, what we have at this stage is a national coverage which was tipping at 87% in 2020, which is too low. We should get as close as possible to 100%, and these 13% which are missing are too much. It's a breach open to poliovirus to come back. And we see as well in 2021 that the routine vaccination has also gone down. Ihor highlighted that, and I would like to reinforce this message. In some regions, in August of this year, we saw as low as 50% vaccination. The door is open. We have to close this door together. We have a situation in Ukraine. On the 2nd of October, WHO was notified of the isolation of poliovirus in a sample of a little girl which was paralyzed, a 17 years old, non-vaccinated. I would like to stress a non-vaccinated element here. And the poliovirus type 2 was confirmed on the 1st of October by the WHO reference lab in Helsinki. The same virus was also isolated from 6 children of the same family, which means that so far we have one cluster. What we call cluster is a group of people living together and getting together in the Rivne province in the northwest of Ukraine. The Ministry of Health has led a multidisciplinary emergency task force to respond to this crisis. And we are here together with the colleagues from UNICEF to support the government's response. I want to go back once again that polio is vaccine preventable. There is no cure to polio, but prevention works. And here the clear message that we pass before you today is let's work at prevention, let's vaccinate the children. Once again, we cannot repeat that enough, that vaccination rates and vaccination coverage in Ukraine have to go up to avoid the door for poliovirus to come back, to keep open. And many countries in the world have managed to close this door. There is huge capacity in Ukraine, and closing this door in Ukraine is something that we should work on together. In Ukraine, we have a functional national polio surveillance, which was able to catch this case early, which is very important as well. And here we'd like to praise the Ministry of Health for managing this surveillance on a regular basis. The two elements that work and that have been defined by all member states in the world in 1988 is all focus on prevention, vaccination and surveillance. That's the two arms of a successful victory against polio. The surveillance arm, which is led by the Ministry of Health in Ukraine, has worked. We have picked up this case. In Ukraine, these events, however, underline the fragility that we have with the low vaccination coverage, 87% once again last year, 50% once again in some regions this year. And we are working really closely with national authorities to do further investigation, to trace the contacts, to do the surveillance, to see where the virus possibly is circulating. And when these results will come, more announcements will be made. But at this stage, what is very important is vaccinate your children and pass the right message. Don't fall to the anti-vaccination sentiments and pass the right message. Polio is preventable. Get your children vaccinated. And I will stop it at that.
Спасибі вам велике.
Thank you very much indeed. And then I would like really to give the floor to Murad Shekhin, really to talk about the hazards of polio and speak about the necessary emphasis on vaccination and really explain to us why, let alone the small one episode, might be so alarming to us. Murad Shekhin, the floor is all yours.
Thank you, dear partners, Deputy Minister Igor Kuzin, the WHO, the CDC, and local partners. Today is a sad day for me because I know that there is a polio case in Ukraine. These are the words that I would not hope to share and see and say in front of everyone, because our motto is every child, good health, and it is the right of every child. And we know that polio is a vaccine-preventable disease. Vaccines work, and we know that there is a little girl in Rivne paralyzed because she was not vaccinated. So our vision and motto is let's eliminate all vaccine-preventable deaths and paralysis and issues. In Ukraine, just 53% of the children under 1 year of age received their polio vaccines during the first 8 months of 2021. So this means out of every 2 child, 1 didn't get their polio vaccine. It's alarming. I call all parents to get in touch with local health officials, their medical centers, to get their child to fulfill their vaccines. Polio is highly contagious viral disease. It infects the human nervous system and can cause incurable paralysis. There is no cure for polio. The only protection is vaccination, and we know that vaccines work. I'm happy to see the ministry is open for cooperation. The international community brings their best technical expertise and support. We bring 2 experts already from our headquarters. WHO bring their experts. So we are working closely with the ministry in understanding the situation, mobilizing resources in addressing the polio in Ukraine. I call on Ukrainian parents to protect themselves from the harmful virus of misinformation. Vaccines work. The decisions we make about the health of our children should be based on facts and from reliable resources. Ministry of Health, UNICEF, WHO are your trusted partners on believing on science and vaccines. Our latest research shows that 82% of Ukrainian parents have a positive attitude towards vaccination. Now it is more crucial than ever to ensure that children receive all vaccinations according to the national calendar. We will continue supporting the Ministry of Health and all parents. Let's get your child vaccinated and keep listening and connecting with the right information. Thank you.
Спасибі вам велике.
Thank you very much indeed. So before we get on with the next speakers, unfortunately, Mr. Igor Kuzin, must be otherwise engaged right off, and so he must really, so we'll let him go, and hopefully all of the other questions will be able really. So you will be able really to ask them, to ask those questions really for the Public Health Center representative. And if you would like really to ask questions for Mr. Kuzin, so we'll keep it in a parking lot and ask him later. So thank you for your understanding. So Mr. Igor Kuzin. And now I would like really to hand over to Yumi Charapov, who is Senior Advisor for Immunization, US CDC. So the floor is all yours, please.
Good morning. On behalf of U.S. Centers for Disease Control and Prevention and CDC office in Ukraine, I would like to express our support to the Ministry of Health, Public Health Center, and our partners who are investigating and responding to the confirmed case of circulating vaccine-derived poliovirus case in Rivne Oblast in a 17-month-old unvaccinated child. CDC is one of the founding members of Global Polio Eradication Initiative that has been established in 1988. And GPEI, this is how we call this initiative, the partners of GPEI have worked really hard and tirelessly all this time with regional and country partners to significantly reduce the global burden of polio. The CDC country office here in Ukraine was established in 2010 and has a strong history of productive collaboration with the Ministry of Health in a variety on large public health projects and programs, including HIV/AIDS and special pathogens and etc. And one of the programs, important programs that CDC is collaborating with the Ministry of Health, it's in the area of strengthening immunization program, focusing on increasing the routine immunization and demand for vaccines. This program is funded by USAID. As my colleagues have mentioned earlier, the the coverage with the first dose of IPV, which is very effective and safe vaccine, in Ukraine, in the national level, is at 87%. But when you look at the sub-national level, now this coverage may vary from oblast to oblast, and unfortunately, in some oblasts, the coverage is low as 50% or even lower than that. And my colleagues also expressed their concerns that it's not enough, we could do better, and we will do better. Also, you know that immunization coverage has declined globally in 2020 because essential health services have suffered during the COVID pandemic and during the lockdown. For example, over 17 million children did not receive important life-saving vaccines that would prevent them from acquiring diphtheria, pertussis, and tetanus. In addition, I would like to remind you, you all remember that the vaccination rates against measles, which is very deadly and very contagious infection, has been declining in Ukraine in the period between 2008 and 2017. And when you have low coverage rates and the essential important vaccines, what happens? We're building up a large pool of children and adults who are susceptible for this infection. And when vaccination rates are low, more people are susceptible. It results in a large outbreak. And this is what happened in Ukraine in 2017, 2019. But thanks to the hard work and leadership from the Ministry of Health with the support of international organizations such as WHO and UNICEF, vaccination rates improved and outbreak stopped. That's why this is important to remember that vaccines are safe and that they work, and if the coverage is high, there's no outbreak. Polio virus, as my colleagues said time and time again, is very contagious. It's a dangerous disease. It can cause paralysis, it can cause other complications such as meningitis. That's why we have to work collaboratively, we have to work hard to ensure that every child in Ukraine gets and receives safe and effective polio vaccine. It is possible, the vaccine is available, and it works. We should leave no child behind. So CDC will continue to support Ministry of Health and global polio eradication initiative partners with this investigation of the outbreak, as well as making evidence-based recommendations and developing response plan. I also wanted to share that at the end of this week, polio experts from Atlanta CDC, our headquarters, will be arriving to Ukraine to join the team here with the partners and the Ministry of Health to provide the technical support with outbreak investigation, developing outbreak response plan, and also developing the plan for strengthening polio surveillance. Thank you.
Дякую вам велике.
Thank you very much. Before we get on, so with Mrs. Irina Kislak's presentation, I just would like really to let go the WHO and the UNICEF representatives. Thank you very much for your presentation. Actually, so the more fascinating things really lie ahead, and more feedback on that from Mrs. Irina. So you have some short time, so moving your microphones. Thank you for your support. Actually, next up is Mrs. Irina Kislyak. So she is the specialist from the epidemiological surveillance arrangements unit at the Public Health Center, and she's an epidemiologist, so who have participated in the mobile team missions. So it is a Transcarpathian region, and can you really cover up all the other things that haven't yet been announced and concentrate more on the details of the investigation? And please brief us about the findings to date, and talk to us about the vaccination, the coverage. Perhaps we are short of the vaccines, ain't we? So why do we end up having such a small, poor proportion of vaccination coverage? So can you concentrate on all those technicalities that both society and the media are interested in, and come and share? And Irina, the floor is all yours. So, good morning, my esteemed participants. I'm very thankful. Unfortunately, our representatives from UNICEF, WHO, unfortunately have left, but I'm very thankful to them for their assistance that they have provided to us during the investigation, and furthermore, so we'll be able really to communicate still better and try to find out the cause and the reason of this outbreak, because of the global day that was marked on the 24th of October, so Global Polio Day. I just would like really to make you aware a little bit that polio had always been, since the onset of the mankind, polio had been around. So in Copenhagen, in Denmark, when we turned in our polio reports, in the museum we came across a fresco about an Egyptian, who was very really characteristic paralysis that is really similar to that of the polio. Polio had been around for a long time, but thanks really to the mankind putting a lot of effort to polio vaccination, a long history of creating versatile vaccines, but we have really the wonderful two vaccines inactivated and live polio vaccine, that are in demand and that are adherent to our immunization calendar. And thanks to it, you might have heard that there are only 2 countries in the world, with the circulating poliovirus, wild poliovirus, Pakistan and Afghanistan. In 2002, Ukraine had been given a certificate as part of the WHO European region to say that Ukraine enjoys its polio-free status. To be able really to reconfirm that we are really free from polio, first of all, we must really identify acute flaccid paralysis cases, episodes, one of the symptoms that we have been discussing, really AFPs. And we managed really to detect these depending on the number of those under 15-year-olds available in the Ukrainian regions, and totally nationwide. For us, this indicator must be 3, because back in 2015, in our setting, we had a vaccine-derived poliovirus outbreak for 2 children in the Transcarpathian region. That's why it's a pretty high indicator for us, and we must achieve that indicator. So because of that, we have this AFP, epidemiological surveillance, underway. It is really ongoing in all of the Ukrainian regions, including the Rivne land. They have worked out brilliantly, and they managed really to detect that pediatric case, AFP episode, really caused by vaccine-derived poliovirus type 2. And because of the case detection, we do have really the elaborated action plan to respond to that episode, and it takes the Ministry of Health really to give out an errand and multidisciplinary task force created. That consists of the specialists of the Public Health Center, WHO representatives, and UNICEF. So they traveled out in the Transcarpathian region, but first of all they set off to the Rivne region, and in the Rivne region really to find out where that polio virus had come from and how we ended up having it. So we had really to investigate all contact people, first of all close contacts, and in addition to that, to be able really to confirm circulating poliovirus of different types, such as type 1 and type 3 inside Ukraine. So we do have some additional epidemiological surveillance for enteric infection. Enteric infection is really taking samples from the environment, from the sewage water and potable water and water from the water basins. And of course we do really testing of the pediatric population, so those children really who really have the acute intestinal symptoms, because polio, you might have read already, it really brings about the symptoms akin to those of acute enteric intestinal symptoms, such as diarrhea and only vomiting and high fever. So you first of all have really to do screening of the pediatric population, and then we really do their screening for neuroinfections of the pediatric population, so the healthy population. That is why first of all, when traveling to the Rivne region, we paid attention really to the environment, and we took samples from those really centers where that case had been reported, and perhaps when children really had communicated, and it was really 10 children per one family, and they are very serious religious believers. And they were very much unwilling really to have a meeting with us, but then they conceded, and then in the course of the conversation we found out that those children really traveled to the Transcarpathian region. So that is why our second visit was to the Transcarpathian region. And the Transcarpathian region, we likewise visited the towns where those children were located. So from that particular family in the Transcarpathian region, 2 children, 2 boys were there, and especially in those towns really who had who kept contact, and we really took the samples from the contact people, and we took really water samples from the environment likewise, and all of those samples were delivered to our reference lab of virological assay of the Public Health Center for follow-up testing, which is still ongoing, and really this detection about the pathogens is still underway. And my message to you, of course, if the children, if that 17-month-old girl had been vaccinated, we would not have reported this AFP case, because really inside the body that is not immunized, mutation had taken place, that took place evidently, and that mutation is obvious with the other children as well. That is why I would like really to refer to those anti-vaccinating parents that unfortunately in the Transcarpathian region, unfortunately there are there are other families having lots of children, nearly all children unvaccinated, under 5-year-olds unvaccinated, we must pay attention to them, and in accordance with the immunization calendar, 18 months old and 6-year-olds and 14-year-olds. As of now, this work is underway, and let alone in the regions, in the both regions, we have really reps from the Public Health Center on the ground who do this epidemiological investigation of those episodes. And as of now, my message to you once again that in the Public Health Center, we have established the multidisciplinary task force consisting of the representatives from UNICEF, WHO, and CDC alike, as really to be able to draft the action plan, so in case of the epidemiological situation fluctuation, and to get a better access to the investigation findings. My message to you is actually we have already drafted, just because of the pandemic, our family physicians, GPs, so better engaged, more engaged with really providing healthcare service to those patients. So it's really to really put the emphasis of the healthcare community, that of the GPs on that. So we have a questionnaire really concentrating on those symptoms that are more characteristic for polio. So it's really to make sure that when running a questionnaire, so as really to have an expeditious hospital admission for such children, so as really to find out the cause, so caused by that pathogen. Thank you very much. So if you would like to ask some questions, please go ahead. So Mrs. Arena, thank you very much indeed. Perhaps we are ready now to do the questions and answers. And as you can see, so only we have really the reps from the Public Health Center, and we'll try really to give the answers to all the questions, but you must really understand that you won't be able really to give the answers to all the questions, and we would like really to remind you that the agenda today, this morning, is polio, and the question really polio, and then the other ones to follow up. So I can see Yuri, your hand. Please introduce yourself, so where you come from, and Yuri Puhach, Channel 5, thank you for this press conference. The question to ask: 1st of October, we found out about this case, and then hazardous regional situation was announced, and then the immunization campaign. So how much coverage in that particular region, and what is the outcomes? Thank you for this question. Yes, of course. We do have really a lot of input to date. So before going into the press conference, I had a talk with the representatives from the CDC in the Rivne region, and they have updated me that 65% of those scheduled refusals, children, so who forwent vaccination first, so now already vaccinated with inactivated polio vaccine, already vaccination coverage, and they have mobile teams established, and they even really didn't bother really to invite pediatric population, so as not really to get them contract extra transmission. So they made mobile teams really to okay, thank you for this question, for this answer. And yet another one, so for COVID-19. Okay, Yuri, can you do COVID-19 after the polio question? So can we do the polio? Natalia. You can inform Natalia Molchanova. The question is that a few years ago, so we had really additional round polio immunization for children, bearing in mind so low coverage of the under 1 year olds. Do you think it is necessary really to do this additional polio vaccination and 0 rounds? Okay, question clear. As of now, so the reps from the health ministry and Ihor Kuzin really has announced that we are waiting for the investigation findings. So depending on the situation that will develop with the vaccine-derived poliovirus, and depending on what we are ending up detecting among the contacts and out in the environment, so this will be really the prerequisites for the follow-up mass large-scale immunizations, the like of which we had in 2016-17 after we had reported polio outbreak in the Transcarpathian region. Thank you. Would you like to ask some more questions for polio? Can I ask about COVID-19? So, as I understand, no more polio-related questions for COVID-19. Okay, let's do it like this. If we fail really to give an answer to that question, so we'll be able to answer that question later on. But my message to you once again, but I'm an epidemiologist, physician, really who do vaccine-controlled infections, and I relate, unfortunately, less so, or so for the good of it, really, to the COVID-19 related agenda. So I'm not in position to be able really to take all of the COVID related questions on your behalf. I will just jot down all of your questions and will really so transfer it to the press service of the Health Ministry. Yuri Puhic, Channel 5 journalist. So the question is, so what do you think, Mrs. Arena? Do we need really to vaccinate the children for coronavirus at the age of 5, as is the practice in Israel now, or US, just because the children also really proliferate the virus, transmit virus, because so not more than 8%, but the children may transmit virus, and is it worthwhile really to vaccinate? And if no, then please explain. Thank you for your question. So we have really the night tag. So this is the independent, so the group of technical experts, national technical group of experts really looking into agenda and also looking into the vaccines agenda, so for COVID-19, so this issue was on the agenda. It's been up and running, but this question is still under scrutiny because indeed now, first off, so we are talking about the adult population, about those low proportions and refusal cases against those vaccinations, because when we travel to the Transcarpathian regions, so there is a lot of religious believers really who say point blankly no, and they do have a lot of religious believers really who haven't been vaccinated with COVID-19, and this is very, very bad. And let alone we came to visit the shops and the supermarkets, and unfortunately none of the people really who came to visit their shop outlets didn't have a facial mask on. So that is why the PPEs are very poor, except Kiev and adjacent regions. So please safeguard your health and do your immunization, not only for pediatric polio vaccination. I just would like really to say that the findings of the meeting will be uploaded to the Public Health Center. They assemble for a meeting once every month, and that night tag group is chaired by Fadi Lapi, and you know him well, and they submit their conclusions to the Health Ministry, and the Health Ministry really has very quick endorsement, so if in case of some findings you will find that out. And yet another question, and that's it. About oxygen access here in Ukraine. So we know that in the two regions of Ukraine there is very bad deficit, Chernihiv and Kherson region. Do you know why it has happened with the oxygen access? Because last Friday Viktor Lashko, so unfortunately I won't take this question to answer. It's really very judgmental relating to, so you will have this comment to follow up later, so from a different specialist of ours. Diana, Channel 4, would like really to say hello to you. How about the third booster COVID-19 vaccine dose? Whether it is feasible and up to date here in Ukraine? Is it advisable really for the people really who vaccinated themselves in summertime really to get on with this vaccination? So after the first two doses of the vaccination here in Ukraine, first of all, so we must provide coverage. So with the dose 2 and dose 1, really of the whole population of Ukraine, and then speak about the booster dose, because the proportion of vaccination coverage very, very low. That is why the third dose, after we will have covered at least 90% of this population, so as really to have herd immunity in place, and so as really to have safeguards and protection against coronavirus. What's your estimate of the situation of the vaccination coverage speed in Ukraine, and on behalf of Health Ministry and Public Health Center, really for us really to speed up this trend and so progress? So the progress now much better accelerated, let alone with the summertime period. As of now, the population has better really approach towards vaccination, and I think that if we have the growth vaccination growth rate just like that, so will be much better off. And we do our utmost, so it's really to have better access, better availability, so we have really a good choice of vaccines for you really to come or intake. And I think that COVID-19, you are very much interested about that, but let us really concentrate on polio now, because it is now very up to date and very up to date. Olena from TV channel DOM. So we spoke about the children and teenagers. Health Ministry ruled a decision from the age of 12. It's possible to vaccinate. When is the start of the vaccination? You do need parental consent and authorization. So in accordance with our regulations here in Ukraine, so vaccination consent and authorization, irrespective of what type of vaccine, so must be really given by the parents, of course. And when we will have really created a press release or guidance document, so published not only in the Public Health Center, but also in the Health Ministry, is that we started really the teenage vaccination campaign. So at the age of 12 plus, so this update uploaded to the site of the Public Health Center and the Health Ministry. There is a cohort of the teenagers. Those are the teenagers, so who will be able to compete and must really travel abroad, or those teenagers who are running the risk exposure, and they must really follow the pattern stipulated in the guidelines, so must refer to the health facility and get reference, and only then come over to the vaccination. More really from our website, please. Pfizer, why Pfizer? So pursuant to the recommendation, so this was a decision approved by the NITAG, so for immunoprophylaxis and vaccination, and this is really the experience from the European countries, and so we have this decision now. Yes, you're welcome. Thank you. More questions? No? Okay, thank you very much for your attention, and hopefully you will keep asking more questions, and you will be able really to send in your questions later on. Thank you very much, and thank you for your attention, and thanks for really drawing your attention to this important agenda. Thanks, and enjoy the rest of your day.